All right. Good morning, everyone, and welcome to our webinar, Worry and Anxiety, Using Evidence-Based Strategies to Help Children and Adolescents with Dr. Erin Berman. I'm Mary Beth Harrison Cunningham. I'm the manager here at the Family Resource Center, and we're very excited to have you with us today with the first in a two-part series from Dr. Berman. So Dr. Erin B. Berman is a clinical psychologist at the National Institute of Mental Health in Bethesda, Maryland. She received her clinical psychology doctoral degree from Rosalind Franklin University, the Chicago Medical School. Her clinical training continued with attending the Boston Consortium of Clinical Psychology, where she was a Harvard Medical School fellowship recipient. She completed postdoctoral respecialization in child and adolescent anxiety disorders at Temple University. Her main area of interest continues to be in cognitive behavioral interventions for children, adolescents, and adults with anxiety disorders. Welcome, Dr. Berman, and thanks so much for being here today.
Great. Thank you so much for having me. Today I will go over general information on our understanding of anxiety, also how do we identify it in kids, and then what obviously, which a lot of people really want, is how can you help your children and adolescents. Feel free, as was mentioned, to put questions in the chat, and we will try and monitor that. I'll also try and leave time at the end to go into more detail as well. And then also at the very end, you'll be able to see resources that we have and ways to contact both me, and then also Kayleen DeHot is on this call as well. She will be in the background, but she also is someone who can help find resources and other things that we have available through the NIMH. So I am part of the intramural program. We're a federally funded agency, and we are located in Bethesda, Maryland, so not too far from Virginia, yet with traffic on some days it's pretty far. So I'll get right into it. So no conflicts of interest here. All the obvious opinions are my own, and overall, I'm going to give general advice, but obviously, for specific advice, you may need to go somewhere else. But I do go into a lot of info and a lot of details, so hopefully it'll be something relevant to everyone. So why have so many images right at the beginning? Because the most important thing to learn about is I will go through just the general structure of anxiety, how to notice it in your children, what to do, but it really appears different in every child. There's not one person, I have to say, who experiences anxiety the same way, or where you can also tell that it's an anxiety or depression. What we do know is that it's become obviously more, we all know this, there is a mental health crisis with children and adolescents. There's been an increase for some time, even before the pandemic. And we can see generally how it breaks out by age, just to give you that information. So if we look at depression, because we're going to cover depression today, we do see that obviously the bigger bumps, and you're going to see this with depression and anxiety, are in the adolescents, right? Which kind of makes sense, I think, overall with, stressors at that age, but also puberty and development. So you can see for depression at 6 to 11 is a little under 2%, 12 to 17 is 6%. For anxiety, as we can see, it's a stronger and more prevalent disorder that you're going to see is about 6% and 6 to 11, and 12 to 17, it's over 10%. Behavior disorders are like something like attention deficit hyperactivity disorder or oppositional defiant disorder. You can see those kind of reach a peak between 6 and 11 and start to go down at 12 to 17. We also know that for depression, I have to move this, the major past year prevalence of major depression, so this is pretty recent, obviously not just this year, but 2021, we can see what it is, the breakdown of major depressive episodes. You can see how very prevalent it is and how disproportionate it is to females. But in that year, it's 20% overall. That's a pretty high percentage of adolescents, 30%, almost 30% in females, and about 11% in males. Again, the age ranges obviously kick in more during more heightened puberty in high school, so about 26%. And then we look at obviously race and ethnicity, and we can break it down a little bit of where we see those discrepancies. So we are National Institute of Mental Health is a research institution, so we're going to give you some research backing and ways to really have a comprehensive understanding of why your children think and behave in a certain way. It is always important with kids and adolescents to take into account development, right? And where they are, because a 5-year-old brain is very different than a teen brain. However, I think us as parents or primary caregivers still have, many times, at least I do, have the same reaction of when my 5-year-old, I expected them to do more. And then as a teen, you expect them to do more. So what are their brains really capable of? And where are there some shortcomings or things that have to be cultivated? When we know where it needs to be cultivated, we can help. For us, some coping skills come very naturally at our age. And for others, especially for younger kids, they need to be modeled, these coping skills. So let's go over a little bit of neuroscience because I'm part of a neuroscience branch. The front part of the brain is called the prefrontal cortex. It's one of the last brain regions to mature during development. Okay. So that is planning. So if your kid's struggling with organizing, right, homework, all those things that can be stressors, it is sometimes difficult for many kids to plan. Prioritizing, we can talk about that all the time. Kid comes home, wants to get on the screens, or kid comes home, wants to play their sport when they might have homework or chores or other things that they might have to do. So prioritizing is also part of the frontal lobe, which again is the last brain region to mature, right? Controlling impulses. That's why we see our wonderful little ones just doing all kinds of crazy fun stuff, but also our teens, taking risks and risk-taking behavior. That all has to do kind of right in the front of your brain. And rational thinking. And this one is a really important one when we talked about strategies and how we're going to be able to, address, this anxiety and depression in kids and how we can help them learn these strategies. It's hard sometimes for them to tap into their rational brain. We do know the emotional brain is obviously developed pretty early on for self-preservation, right? That's more in the base of our brain, right? Like down and in. But the front is, as you can see with this lovely developmental picture, which it shows in overall that the blue and purple is where it's more fully mature, right? A 5-year-old, right? The very front there is not much frontal lobe. So they cannot stop themselves from doing much, as we know. That's why we don't leave a 5-year-old home alone, right? Then we have the preteen brain, which is still, got a lot of blue and purple that's not there in the front, right? So helping them at that age plan, prioritize, organize, and have some rational responses. And then the teen and 20-year-old brain, as you can see, executive functioning and prefrontal cortex is not really fully mature till about in your early to mid 20s. And obviously it's a little later for its males versus females. So what is important to then our next step, now that we know that these are things that are, not coming naturally, but what is it that we can do right off the bat? Right. So because their brains are really like running on emotion, right, as we can all see in the teens and the little ones, right? It was interesting. I was talking to one of my adult patients yesterday, and they were even saying like, I get overwhelmed. They were talking about applying to different jobs, and how, when one thing doesn't go right, they just like fall apart, right? And they're like, I'm like a 5-year-old who's like, building just got, blocks just got knocked down, and I don't see that I should just take a breath and start to put each block up together, right? It's showing you also for someone who has, maybe like a chronic anxiety disorder, it is hard to foster those positive emotions or to kind of get yourself calm and get back to yourself. So that's one thing in the big picture, and I'll give specific examples of what you can do as a parent, caregiver, or kind of teacher, is we want to foster positive emotions. That doesn't mean puppy dogs and rainbows, like everything is great and, don't do your homework and things like that. But how can we, in those moments where we're struggling or we're feeling emotional, foster something a little bit more positive, or it doesn't even have to be positive, but something where we are, trying to solve the problem in that time. If we think back to this last slide with the brain, problem solving is here. Frontal cortex is here, right? And so, our job is maybe to start to model or foster those positive emotions for kids. Again, difficulty seeing the whole picture of baby behavior implications. So that, again, is their inability to stop their behavior, but also, and I'll talk a little bit more specific to anxiety and anxiety disorders. We know that when someone's anxious, just like my good adult patient who was applying to jobs and feeling disappointed and then just kind of imploded in a day, is that we can't see the whole picture when we're anxious. It's kind of like blinders, right? Or people would call it tunnel vision. And really, something that we can add into our kind of repertoire of things to do for kids is helping them know all the different ways that they can solve a problem. So we'll talk about that in a little bit. And this one's a tricky one, I know, because of the school day, because of screens, but sleep is one of the most important things for brain development and neuroplasticity. So their ability to change and, adapt and learn. So what are different signs of excessive anxiety and depression? And I'm just going into this is a general overview, and then we'll go into much more specifics. So worry before and after events. That can be a sign of a worry that's socially related or worry about performance related. So kid might worry about how they did on a test or an answer that they gave or what they said to a friend. This is, something that occurs more frequently, not just a one-time deal after maybe they did trip and fall in front of the whole school. That might be a different thing, right? Irritability is a sign of both anxiety and depression. As we go into the symptoms of depression, that this will be more prevalent in our children and adolescents, where you see more behavioral acting out, you see more irritability versus just your classic crying, sadness, low motivation. We'll talk about those as well, but irritability is quite a important red flag to be aware of, not when it's happening just occasionally, but when you see it on a regular basis, and it becomes difficult for the kid to kind of interact and do things they want to do. Problem sleeping, obviously, is a big one for sure. And that may be falling asleep, staying asleep, or waking up too early, or oversleeping when it comes to depression. And anxiety, actually, because it can be a form of avoidance. Problems being alone. So this is when parents start to bring them to our clinic, is because the kid is having a hard time falling asleep on their own. Parents are not having alone time. We're talking about a kid who's 12, 13, 14. They can't leave the house to take the dog for a walk. So just being alone in an environment that is safe, right? They don't like to be the center of attention, can be a sign of anxiety. Avoiding of raising their hand in class. So they don't want to do it. They don't want all the eyes on me or the attention. But also, not raising your attention, not participating to a child that used to do that could be a sign of depression, but be more a sign of depression if it's something that they used to regularly do and now they're not. A lot of times, again, a slowing in behavior or a lack of behavior can be a significant sign of depression. Self-conscious, so like really worried about others think. Panic, so you're seeing the kids' physical symptoms, sweating, heart racing, trembling, freezing, so just deer in headlights kind of look overall can be what you're seeing with these kids. Worrying, obviously you'll hear it more, or if you don't hear it, you may kind of see it in their physiological symptoms, them being tense, having difficulty concentrating. Kids will complain of stomach pains or butterflies in their stomach, their flight or fight response, or problems concentrating, and so many more. And we'll go into more details. But please, if you have any questions, let me know while we're going around. So again, back to these for a second. All of these things will probably happen to many kids, right? When does it actually become a disorder? When should we start to think about getting help for our child, or start to even just practice skills with them on a daily basis? One of I would say when any of my anxious individuals see this phrase, anxiety girl, able to jump to the worst conclusion in a single bound. So that is obviously this all or nothing thinking, which we'll tap into a little bit. This catastrophic thinking is very, normal indication of anxiety disorder. So it becomes a disorder when we stay away versus approach things. And every time a child walks into, or an adolescent or even adult walks into my room for therapy, specifically I do cognitive behavioral therapy, many times I will say, okay, I'm not here to change you or your preferences or your personality, right? But is there something that either the depression or anxiety is either making you unable to do that you want to do, right? Or something that you have to do, right? And many times it is the case that Many times it is the case that it's something they have to do. That's when we start to see it as problematic. So they have to go to school. They need to raise their hand in class, or they really want to have a birthday party, right? Or they want to go to some kid's birthday party without mom, right? So avoidance versus approaching things. Many times my classic, kids who don't want to, divulge that they have anxiety, you'll start to see them pull back from things they used to enjoy. So, no, I don't want to play soccer anymore. And those kids are mean. And then you go, oh, I don't want to play instruments anymore. This kid is XYZ. So, all these things where they start to pull back, it also can be a sign of depression. And, when I go over the symptoms of depression, that'll help you hopefully tease that apart. Interference, right? So this is again where the whole family is not sleeping, maybe because the children are having one child in the family is having a separation anxiety disorder, right? So they can't fall asleep on their own, or they keep coming into their parents' bedroom, and where it becomes excessive and interfering, right? If it's part of the family, part of the cultural, that is totally fine. It is when it's getting in the way of maybe even the parents' sleep, or a lot of times we'll even start to see it when the siblings, right? Issues like that. Distress, so you see them kicking, screaming, crying. Tantrums is a typical one you might see in the younger ones. In adolescence, it might be screaming and kind of stomping around, that kind of stuff. And the biggest part is it's persistent versus transient, right? So overall, we can make sure that, we can all have weeks or a day where we may hear about something on the news, or, something might be happening in our family that might make us anxious. And if that goes on with a stressor, that's different than an anxiety disorder, which is persistent, right? This is usually, to me, diagnostic criteria. We want to see these symptoms going on for about 3 months. However, unless it's something that's interfering immensely. So I have to say many times I can make the diagnosis of, let's say the kid is refusing to attend school for 3 weeks in a row. Now that's a problem. They need to be there. So that might be a situation where we wouldn't need to see the persistence. So what are the anxiety disorders? There we go. So these top 3 are the 3 that are grouped at NIMH studies, but there are plenty of different ones. But they are also going to be the most typical ones that you will see in children and adolescents. So separation anxiety disorder. These are my little sweet, clingy kids. They are either worried about something happening to them, or they might be worried about something happening to their mom or dad, right? And it can range really through the age spectrum. I've definitely had kids who are typical 8-year-olds who are nervous and have just difficulties falling asleep without their parents next to them. And sometimes there's elaborate rituals to go with it just to let them fall asleep. And it all starts out in a good place. That's why I'm really glad you're all here. This is very normal as a parent to come and want to soothe and sit next to your child at bedtime. Very, very normal. However, if they have excessive levels of anxiety, this can be a hindrance to them overall, right? So worries about, someone breaking into the house, right? Worries about mom or dad getting in a car accident. These are the kids who are nervous when mom or dad are late to pick up, or they don't come at the certain time that they're looking for. One of my favorite examples, and I think this is just good to teach anybody, is, kids can be very creative about how they cope with it. If they just need the cat in the room, maybe that's not such a big deal. But I had a patient many, many, many years ago, who would tell me why they came is that the boy would say around 10 and had a younger sibling around 2 or 3, right? And the 10-year-old would regularly wake up the 2 or 3-year-old at like middle of the night and put them in their bed. Well, you can imagine this would in the morning cause quite an issue for the parents in terms of kids would be tired, groggy, hard to go to school, right? But he was like, I'm sleeping in my bed, but he had to have his 2 or 3-year-old brother next to him. And I was always wondering, like, how is that safe for you if you're worried about, someone breaking in or something happening. And I think ultimately the bottom line is someone next to you does feel comforting, but his rationale was, well, at least they'll take him first, my siblings. So I always found that, it's a very creative mind is the anxious mind. And I tend to like to have a fun, humorous approach when I work with children, because the anxiety does feel so scary. We need a way to diffuse and make the energy not as intense as anxiety really does feel. And we'll go over that it really is a bona fide physiological feeling that these kids are feeling. It really is their amygdala turning on a little too much. Our generalized anxiety disorders are in the little ages, like I always call them my little old souls. So they, their mind is always going to, worst case scenarios. So they may be sitting and reading a book about polar bears and then start to think about global warming and then worry about the end of the world, right? Their worries are persistent, meaning they're usually daily, and they are things that are not abnormal. So it could be worries about bona fide things like, climate, money, their parents' divorce, and schoolwork, being perfectionistic, and health concerns. And it's a worry that kind of cycles. They have kind of the worry of the week, you'll hear. And to meet criteria for this diagnosis, you also want to look for usually some physiological symptoms. Because you can imagine if your mind is always worrying and thinking, you probably have something like maybe headaches, stomach aches, difficulty concentrating, difficulty sleeping, and irritability. Social anxiety is one of the most common, specifically in adolescents. That is a worry about, oh goodness, like, does this person like me? And not just in a small way, but in a way that might become obsessive, right? And a worry that's a very negative evaluation that people are seeing them. These are in the littler ones, maybe ones that can't say hi to their teacher, even though they've known them for a couple months, can't say hello to their peers, this difficulty playing in the playground. It also can be, again, we'll talk about this fine line of depression as well, a sign of depression when we withdraw from kids and people, but for sure it can be a sign of social anxiety. And the biggest part is that they're afraid something bad's going to happen to them, right? That someone will make fun of them, or they'll say the wrong thing, or simply some kids will say it just feels bad. And again, realize it looks different in every kid. You can have some kids who are musicians and play in front of people, but can't say hi to a kid next to them. And as many of them will just say is, well, I have, the music, I can practice my music, but, talking and saying hi to kids is like, that's an impromptu thing that I can't anticipate. There's a lot of uncertainty with that. And that's the key to anxiety disorders, is it's really an inability to tolerate uncertainty. We have specific phobia, which is, as it says, the typical ones that we'll see that might interfere in kids' lives are vomit phobias. I know those are ones where kids are afraid to go to school because kids do vomit, but they're afraid every day and that they might feel nauseous, that they might vomit or someone else might vomit near them. Bugs, bees, we're out of that season for now. I guess they're all retreating. But those would be a kid, not who just doesn't like the bee, but won't go to playground because of bees, or won't eat outside because of that. Tornadoes, storms, all those kind of things. And it's something where it's happening on a daily basis. Panic disorder, we're not going to see a lot in the little ones. It kicks in more around puberty. And it's really the fear of fear, or the fear of physiological symptoms. So you're afraid of feeling nauseous, getting upset stomach, and having a panic attack. You worry about having a panic attack. This one we won't go over too much because it's less likely. Many times you will see panic attacks in these diagnoses, but panic disorder is its own thing. And selective mutism is really a part of kind of social anxiety in a way. It is an extreme way of the child is verbal and happily chatty at home, but pretty much mute in the school setting. So I'm going to check the chat to make sure there's nothing for me in there. Okay, good. Let's see. There's 2 questions. So this is wonderful. And we'll go from there. Okay. So if the child has anxiety and the parents don't stay with them in their bedroom, won't the child get even more anxious, unable to fall asleep, and cause further trauma? Okay. So again, the bottom line is, if a child has anxiety and they don't stay in the room, okay, the bottom line is, first of all, we want them to feel safe, right? And we don't want them to feel inherently dangerous. So I do recommend making sure the room is comfy, making sure the house is calm as much as you can with a million with children. And really the idea, it depends on the age too. So obviously a super young one, I would look at this at 8 and up, right? A little bit more, unless it's really interfering. It won't traumatize the child if you do it little step by step, right? To staying with them in their bedroom. And again, bottom line is, if it doesn't interfere with the parents, that's totally fine. But if it is bothering the parents or the child, we do want to kind of slowly wean them from this, right? The child will get a little more anxious at first, but what we'll start to learn through this whole presentation is anxiety won't hurt you. Now, if there is a traumatic event that's attached to sleep, so something awful happened while they were sleeping, that's different. If it's a post-traumatic stress disorder, we would want to be a little bit more conscious of that. However, if it's just a child having difficulties falling asleep, we would teach them some coping skills and way to start to, calm themselves down. And we don't just then leave them there and shut the door and lock the door. Usually it's kind of something like this. So I will stay with you for 10 minutes tonight, and then I'm going to go downstairs for a minute, and then I'll come back and check on you and stay with you for another 5 minutes. It's slowly kind of weaning them from it, because kids many times may want to, one day, go to a sleepover, not talking till they're much older, or they may want to be able to go up and down their house alone. And so you won't traumatize them if you are both on the same page, you and the child, of what you expect, right? And also what it is that you want to accomplish. So you'd want to do it that way. Vomit specific disorders. How do you recommend supporting a third grader as a school counselor? So that would be a twofold. One thing most important with that is, making sure the child, has something that's calming and relaxing, a fidget, or something to stay in the classroom, because what the most important thing is, we don't want them to leave the classroom. Or if they do leave the classroom, we want the expectation to know that they can go get a sip of water and then come back. Because what we'll see is, by doing something that is leaving a situation that is not dangerous. So again, if someone's vomiting all over the floor, no problem. They all want to leave. Kids, that's fine. But it is helping them stay in the situation and really let them know that they are safe. And I think as a school counselor, you can also say, what's great is we have nurses, we have plenty of teachers, and they will make sure that you're safe with this, right? You'd also want to figure out, what is the specific fear? Are they worried about vomiting themselves, or are they worried about someone else vomiting, right? So that would give you, you'd want to get that specific thing. And then you'd also want to get the parents a little bit on board, because in a way, if it is a worry of, let's say them throwing up and then being embarrassed, you'd have to come up with a plan of how to do with that. And obviously, if you have anxiety, you can get nauseous and also throw up. I definitely have poor panic patients who will walk into school, throw up a little bit when they're nervous, and then go back to class. And I can go into more detail later. I've got another question. So my wife has what I feel is poorly controlled anxiety disorder. Now my son has been diagnosed with it as well. I very much felt that dealing with my wife's issues really had me at the end of my rope. That was fair. And your son too as well, right? Yes, right. Yes. I have no idea how I'm going to do double support with my son. What support is there for others in a family without these issues? What can I do for myself in this? I feel guilty asking this, but I really feel there's nothing left for me to give. Well, I mean, it's exhausting. And if you have two, then that's super exhausting, right? I'm going to give a short answer. I mean, the first one is obviously our classic answer, is definitely take care of yourself, right? Because the more that you take care of yourself, the more you can be there for your son. Unfortunately, again, you can't take care of your wife. She in a way has to kind of manage it on her own. There is this interesting, and you could show it to her. I don't know if she'd be interested, but there's a great program, and you can find it online. It's SPACE, like SPACE. Even just reading a book on it might help you a little bit. And it's actually interventions for people with anxiety disorders, and it's what the family can do, right? So it's a SPACE program. It sounds funny. I feel like being in DC, but the SPACE program by someone called Ellie Leibovitz at Yale University. And it is something that maybe I would just even Google it and watch a few of his videos, or even show them to your wife maybe, and they'll help you help him. I think you'd have to figure out who you want to kind of first intervene with. So Okay. Very good. Yes. And if we have a little one with severe anxiety, I see that. That's where you slowly have to pick your battles. If you got a fear of everything, if that's the little one that's having difficulty sleeping. And does confidence in school result from feeling anxiety or any mental health as a parent? How can I help? Okay. Does confidence in school? Yeah, I mean, for sure. The less, well, and it can go which one comes first, the chicken or the egg. So anxiety, as we said, is something that makes us have difficulty feeling good about ourselves, even depression or tolerating uncertainty. And so I'll go into more of those details. That's a great one. I will try and remember that. So when we hit the interventions and what you can do to help with that. So this I like to show, even for my last individual, to show either their child. I mean, it sounds like their wife probably knows they have anxiety. But what do we do? And this is one of the biggest things we can help kids with. This might be the kid falling asleep at night. This is the kid worrying about vomiting. So my vomit question, the little bit I'll tell you at the bottom. But showing them this diagram, I think you guys will probably get a copy of the slides. I believe if not, I can send them. Is that really anxiety is your brain's signal that there is danger. Now, no longer are we living in the woods, forests, and having to forage for our food. And so where does that anxiety and alertness go? Well, it goes on homework. It goes on vomiting. It goes on, what is the worry of the day? But when we even have simply a thought about a test, or we simply have a thought about our future, we can get, just from a thought, no difference than if there was a bear next to us, stomach aches, headaches, nausea, frequent trips to the bathroom, tightness or pain in your chest, sweating, dizziness, lightheadedness, heart racing. The most important thing you can do if we have our little, third grader who's worried about vomit, or our 5-year-old who is concerned about, sleeping, is if they're freaking out, just listen, right? Do your best to not at all freak out. Now, if you're going to freak out, that's okay. Plenty of parents do. We all have freaked out at the wrong time. Nothing wrong with that. But just so for your information that you know this, right? Listen and don't talk loud. Be that calming influence, right? Remind them that this ends. And grounding is one technique you can use, but most importantly are those top threes. Because if you talk while a kid is stressing out and freaking out, it gets you nowhere. The best thing you can do is have them listen, relax, try and breathe, and let them know that the anxiety eventually will go down. It doesn't feel like it will, but it absolutely will. Oh, wait, hold on, let me go back. And then we'll go to depression. Let me see if I have a couple questions. If there's anything. Okay. Oh, thank you. Whoever put Dr. Leibowitz's. Thank you, Mary Beth. Wonderful. And it's really, he has some great just videos. You don't have to buy the book. So how to help a teenager who procrastinates their work. Okay, I'll get to that one. I'll leave that. Is there association between anxiety and physical sensitivity issues? Yes. Well, that one I'll go to just because we're on the physiological symptoms right now. So is there any association between anxiety and physical sensitivity issues? For example, socks or shoes? Yeah, sure. There's two things that we know with that one without going into too much detail so I can get to the depression stuff. But for sure, if you feel uncomfortable, that's going to turn on your alert system. Does that make sense? Right? And that can be just to have a physiological sensitivity that's inborn, right? And also sometimes, depending on the age, there's also a component of obsessive compulsive disorder. That's like things don't feel right. It has to feel just right. And that also will increase and cause some level of anxiety, if that makes sense. Okay. Let's see, going on. So now that we've hit the depression overall, we're going to talk about major depressive disorder and what are you more likely to see and the difference between that. And where did I lose? Oops, sorry. There we go. Oh, it's jumping around. Okay. So there we go. We have that. So mood, you're going to see obviously mood on top of or instead of anxiety symptoms. So as we showed you with anxiety, it's more stress, intensity of like physiological symptoms, attention, irritability. Here you're going to more likely see lower mood, lower motivation, teary or irritable, depression, sadness, but some people will not even endorse the sadness. Many times then you'll see more of the irritability, if that makes sense. And you'll see this to get a diagnosis of depression more days than not for 2 weeks in a row. So let's say, pet passes away or family member passes away or something really sad does happen. They read about something in the news. It may be normal to be sad for a few days, a week, but if this is something that's persistent most of the day, then that would lead to a little bit more levels of sadness and irritability. What you see versus what you hear. So many times with kids, you are going to see more behaviors versus maybe even them endorsing that they're sad or depressed. They'll socially withdraw. So these are kids that used to be much more social. They're not, engaged as much. They're staying away from school or the activities they used to like. Somatic symptoms. So that is like, feeling uncomfortable, having stomach aches. So in a way, it still is similar to the depression, and difficulty finishing tasks, low motivation and homework. And this is where we have to tease apart, and it's helpful to think about sometimes low motivation and inability to do homework is related to anxiety and avoidance, and sometimes the low motivation is due to depression. Sleeping, eating, and energy changes, so complaining about low energy, or they sometimes can have hyper energy a little bit, eating too much or too little, and as we said, trouble falling asleep, staying asleep, or early morning waking. Thoughts that you're going to hear or you're going to see or they're going to endorse are feeling worthless, hopeless, or guilty, all or nothing thinking, so either bad or great, or thoughts of death or suicide. There we go. No chat. Okay. So do I have depression? These may be some questions that you can either ask in a way to the teen or in a way kind of fish for. So do they often feel sad, anxious, worthless, or empty? Again, often, not just a few days here or there, or if someone rejects them at school. Have you lost interest in the activities you used to enjoy? That's pretty one of the big hallmarks, in my opinion, that you will see. Do you get easily with children and adolescents? So they won't want to play soccer. They won't even want to read the books they used to enjoy. Do you get easily frustrated, irritable, or angry? Do you find yourself withdrawing, or do you see them withdrawing from friends and family? Are their grades dropping? Can be a sign of depression, however, also a sign of avoidance with anxiety. So again, depression and anxiety you can have both, right? So they can go hand in hand. And so it's very important to kind of get someone, whether it is a psychologist, your primary care, to help tease this apart if you are, having questions about it. Have their eating or sleeping habits changed? So that's the big thing, change. Do you see a change from the way they used to act, right? Experiencing fatigue or memory loss, and thoughts about suicide or harming themselves. Depression looks different for everyone, and you might have many or just a few of those symptoms. So, but this is a very good guide that the NIH puts out. So let's start to think, how can we help? Right? This is pretty important part, and this is probably why you're all here, right? So we want to normalize anxiety. The best way to reduce anxiety is start to normalize it in the child. Like, hey, and you can start to identify it. So the little 5-year-old that's worrying about, let's say, I don't know, something intense happening. That sounds like your anxiety speaking, right? And they'll be like, well, how do you know it's anxiety? Well, it's a signal that something dangerous is up, when there's nothing dangerous happening, right? Nothing inherently dangerous. That's what the type of anxiety we're talking about, right? It tells us to look for help. So, it's getting us on guard, right? We need anxiety as a parent, right? Sometimes, change in our child, let's go help, let's go fix. And we'll talk about how sometimes you want to help and fix, and sometimes you want to let them figure it out on their own. So it is helpful for us. Anxiety, if you do nothing to it, if you just watch it, it will come and go. And I think as adults, we can all remember times where we felt very anxious, but we've never felt that way, this high, all the time, right? Meaning we want to educate our kids on what does it do and what does it look like? Because a lot of kids have it and think, oh my God, it's never going to change. It's awful. It's bad forever. No, these are normal and it will pass. And the biggest thing as a parent, caregiver, professional is we don't always have to fix it, right? We want to see what is in this child to help them fix it. We want to help them, give them the skills and help them feel confident. But remember, we don't always have to jump in. Not always. Many times we do, but we'll start to tell you, I'll start to help you tease apart how to know. So then the specific example is kids, how do we use these kind of tenets to address test anxiety? Okay. So again, your mind's going blank, and then you go, oh my God, I need to think, I need to think, I need to think. That actually makes it worse, right? It's back to, I haven't done this yet in the presentation. We'll go back to the white bear experiment, right? So you all can do it with me. This is great. We're on Zoom. You can do this in the privacy of your own home. But essentially, an experiment that was done many, 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 many years ago was this idea that, and you can all just follow my voices, close your eyes, or you don't even need to close your eyes. I have to say it, because when I do this with patients many times, I don't want them to feel uncomfortable in session, right? If they don't want to close their eyes. So close your eyes and do your best at this moment not to think of a white bear. Do not imagine a white bear. Make sure you do not have the image of a white bear in your brain, especially a white bear with a pink bow. Do not imagine, I always add the pink bow because I think it's cute, a white bear with a pink bow. And what happens is you think about it more, right? So we first want to educate them on, this is what happens before you take a test. The more you go, oh my God, I got to think, the worse it can be. So let's calm down our body, okay? Breathing, saying something to ourselves, doing some muscle tension and relaxation, exercises. So tensing our shoulders and then relaxing them, right? I'm okay now. And then hopefully your brain will come back online. And it's practicing this over and over again that will help you start to loosen the grip between, what is the worry and anxiety. Let me look at my chat. Okay. The senior one. Okay, I'll answer that one a little later. Okay. Okay, great. Let's see, let's go on. Okay. So on top of, hopefully, as we picked up the physiological stuff, right? Oh, my physiological side is back here. We want to calm the body, right? Breathing is one of the best ways to do it, but in the moment is very challenging. So practicing breathing, right? We want to learn to calm our body. We also have to address our mindset, right? And this is with depression and anxiety. So I think this one's a very important slide because you can use this for both, either or both. Many individuals who are anxious because they're wired for threat, right? So we know from the research that was done in many groups, including our group at the NIMH, is that you can see an oversensitivity in the amygdala to threatening things when you have higher levels of anxiety, right? So meaning that you're, one of my favorite first patients when they were little told me it's like a overly sensitive smoke alarm, right? Like my anxiety is like a smoke alarm, right? But it's one that goes off too much. Probably like the one in my kitchen that goes off all the time when there's just like a little bit of smoke, right? But we want it all. We actually really do want that in our kitchen, right? Like we want to pick up on everything in terms of that. However, if we do that in our everyday life all the time, it's going to be hard. So as you can imagine, when you're having danger lighting up in your brain over and over again, we start to feel bad about ourselves, right? We get to be very critical. We get to be very overthinking and all or nothing thinking, right? Like I'm either perfect or I'm completely failing at life, right? This you'll hear in depression, right? But you'll hear mostly about the failing, not the need to be perfect. You'll hear more of a need to be perfect with anxiety. And what's important to know with children with anxiety and that are perfectionists is, okay, sometimes you have the overachievers who are staying up way too late, who are spending way too much time in assignment, but you also have the avoidance kids in this place, right? So I remember a girl from a few years ago who, everything had to be perfect. So doing art was very challenging. She loved doing art, right? But you're going to mess up. It's not going to look the way you imagined it when you finish. And being able to work through things versus having them perfect on the first try is kind of something that, we wanted to really work on in therapy. So knowing that but she actually would never do anything then. She never turned any assignments in and was failing. But she purely had anxiety and generalized anxiety in particular. And the future is worrying about the future, worrying about what may happen and having a very negative view. We want to express a new mindset, like one of my favorite quotes, experience is the name everyone gives to their mistakes. Instead of mistakes or failing, it's just experience. Now, that is way easier said than done. I get it, but the more we can kind of embody those feelings and thoughts, they're good things to translate. As you can probably all tell, I am a sports fan. And so this is a really good way to think about, I like for a lot of my patients who are into sports or into numbers or into logic, it's a great one. So I've missed more than 9,000 shots in my career. That's a lot, right? I mean, he is Michael Jordan, so I'm sure he's a perfectionist, but still, he's missed 9,000 shots. I've lost almost 300 games. 26 times I've been trusted to take the game-winning shot and miss. Now, that he's remembering this data is a bit suspect, but it's really important overall, right? But it is true. I've failed over and over again in my life, and that is why I succeed. And this is something we really need these perfectionist and depressed kids to really start to understand. Failure does not equal you are a failure. Failure is how we learn, right? And the more we can couch that, the better we're going to be able to counteract the anxiety signal in our brain that's saying, look at this is bad and dangerous. So what do we do in the school setting? And these are just the big tenets, and then we can talk about specifics later on, but they're just to kind of give you a guideline of how am I handling this, and what are some things that I can do that we know our evidence-based strategies have been tested out in research that work. So because these kids are already wired for feeling anxious and stressed, be sensitive. Best thing you can do is just listen. Listen, and then we'll talk about the other side, not accommodating too much. Listen, be empathetic, right? And then push them back on their way, but be sensitive. Educate yourself and them. That's why I spent all this time at the beginning showing you what is anxiety, how is it helpful, but when is it not, right? And just knowing anxiety can't hurt you, it's just a feeling that you have to walk with is important for the kids to say to themselves and you to say to them. Give positive feedback. Like I said, they're already so wired for negativity that when you can find those positive moments, please focus on those. Be consistent, meaning whatever we expect the kid to do, that we do it then on a regular basis, right? So they don't feel like everything they cannot anticipate or not know when it's going to happen. And focus on problem-solving skills. As the beginning of this lecture was going on, it was about the frontal lobe. And the frontal lobe is where we learn about problem solving and how we solve problems. There really is not, well, there's a few in the world, but there's really not a problem that we can't find a solution for. And that is something we want to kind of give that idea to children and adolescents. Now, maybe they don't like the solution. Maybe it means catching up on schoolwork. Maybe it means talking to that teacher. But there is many times anxiety and depression will leave us frozen, stuck, or low motivation. We have to figure out, how do we get out of these ruts and how do we focus on problem solving? Now we'll go into what you can do as a caregiver, a counselor, parent, is don't accommodate the anxiety too much. It is normal for us to want to jump in, save, and soothe our children, right? We don't always want to do that. Now, we have to pick and choose in a thoughtful way. We don't just say to the poor kid that has never slept by himself, okay, sleep by yourself and run out, right? But how do we make sure that we're not taking away from things that they actually can do? Don't let the teen avoid too much, right? So many times, the parent will say, well, they don't want to play soccer, so I didn't make them. They don't want to do this, so I don't make them. And not that you have to make them do a million things, but just see if it's a pattern that's starting to happen too much, that figure out where you can kind of broker them to do a little bit more. Singling the child out or ridiculing. This is more within kind of a classroom setting. To watch out to see if other kids do this, right? Correct, right? Well, if they're ridiculing a kid for having anxiety or stress or being different, or singling the child out. This one is very subtle, and I actually failed miserably. One of my first sessions ever when I was learning was a little girl came in, I remember, for an interview. She had the coolest, prettiest, funkiest bow on. I should have known, being that I'm screening people for anxiety, to not single her out, to not get all the eyes on her. And I looked at her, and the first thing I said, which again, I've learned, is, oh my God, that bow is so cute. And oh my gosh, she turned bright red and ran out of the room. I eventually got her back. But that's what I mean is by singling the child out or letting the child speak, saying to the child, you didn't do your homework, like in front of the whole class. If we have a child who has an anxiety disorder or depressive disorder, we really want to watch ourselves with that. Unless it's 100% necessary, which if it is in the classroom, that's different. But I think many times we don't have to do that. Excessive reassurance, those are things that more likely the caregivers, grandparents, mom, dad will do, is say, it'll be okay, you'll be fine. Well, or, they'll come to us and say, well, someone break into our house. No, no one will ever break into our house. Or will there be a fire in this house? No, there'll never be a fire in this house. Those things we don't want to do. And we don't want when they ask us, and excessive means they're asking us over and over again. If you have a conversation once with their kid, or even twice after they see something on the news, that's very different than the child that is worried every day that someone's going to break in. So telling them that's okay is not the best response. A better response would be like, what do you think? Or what have I said before? So they can start to internalize it here, and they're not looking for you to always fix it, right? We're trying to train them to feel that they have a lot of self-efficacy. Being too directive, so taking over, that means, writing those emails too much to the teacher, depending on the age, speaking up for them when they're nervous, and then criticizing too much. That can also be something that can be challenging and, normal for us. I can't tell you how many, and I'm sure I've done it. Parents will have a child who's nervous about doing their homework, nervous about a certain class. And then of course they want to be on top of their schoolwork. So you need to be on top of it. But then, and you have to watch, but an anxious child or depressed child will see that as criticism, right? So just watching your words is important. So what do we do? Again, active listening and help them express their feelings. That's one of the best components. Listen, let them express, and then try and help them figure out a way to cope, right? This is a great one that I think is underutilized, is role-playing social situations or any situations that the child might be anxious. Kids have a fun time doing that, where the parent can be the kid and the kid can be the parent. Or more specifically, if they're worried. I remember I had one girl who was out and out refusing to go to school one day, and we just asked, she came into session, she said, well, I needed to get my yearbook and I didn't even know how to ask someone. And so I just stayed home. I couldn't even do it. And just me role playing it with her or practicing with her mom is very helpful. They know then what to expect and what to say. It's not always going to solve it, but these are just different interventions you can think of and play with, right? Obviously, we have to be, social media is not going anywhere, correct, right? And so we really need to keep an open dialogue with the kids all the time, right? That doesn't mean every day you're checking on their feeds or every day you're asking them what they're doing, but really understanding that, that anxiety, that things on social media can add to anxiety and depression, but not just letting it sit there, talking to the kid about how these things might be a filter, how these words are hurtful, and different ways to kind of navigate it and just create an open dialogue. If they don't want to talk to you, then you say you got to talk to your therapist or a friend at school or a religious leader in their church, anybody, but just so they have somewhere that they can do that. And also, you're not alone in this. There are many great, awesome teachers, counselors, social workers, like I said, basketball coaches. Find those other adults besides just you that your child or adolescent can talk to. And it can be a friend, it can be a peer that you really, feel like they're a good influence on the child as well. And I'll check my chat in 1 second. But again, model behaviors and problem solving. So if you have your little bitty ones, I think it's always good to express when you feel anxious. Mom's feeling anxious, she's late. What am I going to do? I'm going to do X, Y, Z, right? Then the next thing is, and then how I'm going to solve it. Social belonging is very important. That does not mean these children need a huge group of kids, right? It's not that they need 50 friends. It just means that they have 1 or 2 friends, or they're part of a team, or they play Dungeons and Dragons. But having something where, they are feeling comfortable and that they can talk to someone their own age. Positive peer support transfer, that's the same kind of thing where they have that friend that they can actually go to and ask for help, ask for tutoring. It really helps to have those peers to model behavior too, and boundaries modeling. Well, that just means we also need to manage how much we are helping and overtaking the child's life. So let me look at the chat real quickly. And that's still okay. Resources for seniors heading to college. And how do you decide whether to pursue a 504 plan or IEP based on anxiety sensory processing? Do we just tell the teacher to watch out for ABC, or do we establish an official record? That's a great question. And I think obviously the Parent Resource Center is one great place that can also field this a bit. But I think it's, most importantly is, do you have any primary care or counselor or social worker that you can talk to. It really depends on how much it's impacting at school, right? And if it is impacting the learning, and the teacher, some teachers will just easily, you tell them I need you to do XYZ and they'll do it, that's fine. But if you want something that's more consistent across teachers, getting a 504 or IEP is something that you can look into for anxiety. I have plenty of patients who do that. And then my other one before I forget, advocacy groups for mental health for while they are at college. Maybe Kayleen can look at that one, resources for heading to college. My daughter is not neurotypical and is overwhelmed with the idea of leaving for school. That makes sense. It's hard to think about that, and it has made her rethink her choice to want to go away to staying at home. She will miss out on opportunities as she thinks she will be alone at school. I know there are groups that support students at school. Okay, I will look for some resources, one, and then also usually that the specific college has many good resources as well, depending on the college that you're looking at. Okay, so what do we want them to know? When they're feeling anxious, what do we want to say? Some version of this. You don't have to do it exactly like me, obviously. You don't have to be me, but you want this theme. You're brave. When you tell the kids you can do it, you're resourceful, you're a thinker. This is what we want them to do. So, because anxiety robs you from you feeling like you can cope sometimes, specifically in kids and adolescents. You have everything inside you to cope with things brilliantly. You have everything you need inside you to cope with things brilliantly. Again, you don't have to say this exactly, but somehow, empower the kids that they can cope. Anxiety feels like we can't, but we actually can, okay? Don't let your mind tell you that you can't do hard things because you can. Again, anxiety will have that little alarm and tell you, freaking you out, but no, you can do that. You absolutely can. So having confidence and building on baby steps. I'll show you how we can do baby steps so they can feel more confident in their worries. We want to, instead of protect our children from everything, right? If there's something dangerous, of course we want to protect them, right? But instead of trying to protect them, we want to just be there to support. We are there to support them. So loosen and have a ton of empathy. I get it. I get what you're going through. This is tough. Although I'm not a, 8-year-old child, 16-year-old, right now, I can understand this is hard. Just saying those things will help reduce anxiety to some extent. Acceptance. Okay, this is where the kid is right now. Let's not fight where they are. This is what always happens with parents is it's like, and I would be the same way. I want them to do this better or feel this much better. This is where they are. Because when we figure out where they are, we can start to problem solve and make them feel better. And we're also not fighting it in our own selves. I have faith in you. Another question that's great to ask is what's going on in your head? And then you'll hear me over and over again harping on have them figure out problem solving skills, right? You model it yourself. Be like, I have this problem. These are the 5 ways I can solve it. And this one is probably the best option. Really talking things out loud can be very helpful in modeling for kids and adolescents. We'll talk about gradually facing their fears or their problems. That is a big part of the therapy that I do is having them actually do the things that scare you and obviously try to place limits on social media. It's got to be on there. So this is why this is a great image to help you understand why we want you to help them face their fear. So if you look, we have on the left side, right, where we see a boy who is just thinking about a dog. He's scared, right? In the little red thought bubble, it's like, ooh, that's a scary dog. The dog comes up to him. That is probably not, in this situation, we're going to say that is not a scary dog. That is not one that can bite him. But instead of not that he has to jump and pet it right away, instead of just even looking at it. So we might have a kid with dogs, we have them just stand near one, right? A calm one. Instead of just standing there and feeling anxious, but letting your anxiety go down, the child runs away. And when you run away, that reinforces that, look it, they're scary because there's no new information to determine that it's not scary. So as you can see with this exposure, we want to build the confidence, right? We want them to face their fears little by little, and then they keep going. And then if you look, thought bubbles blue versus red, but overall helping you understand that actually this isn't a dangerous thing. So you have to face their fears. You usually call something called an avoidance hierarchy. So we come up with the things that the child's been avoiding or not doing, and we come up with a very slow little challenge. So I have a kid right now who has social anxiety. We started with him just, we're lucky being at a clinical center at the NIMH is we have lots of people around. I have lots of research assistants that can help. And what we do is, okay, so your first thing is just going to say hi to me. That's the first one. That's like a 3 on a scale of 1 to 10. And then I'm going to bring in a new friend just to come into the session, say hi, and then leave. And they would say, well, that's a 4. Okay, we'll do that next session. And the following session, we bring in 2 new people. Okay. And they slowly work up to saying things. Another thing with this individual, super awesome kid. But when you get anxious, sometimes you go inside yourself, so you freeze. So his voice gets really quiet and people can't hear him. So just practicing, okay, I want you to speak a little louder in session. Ooh, that feels bad. It's like a 4. But just practicing that over and over again. So that's what I mean starting slow. I'm not having him go out, give a speech, but what are things that he will need to do in the future and figure out how to make that hierarchy. And looks like I have a lot of good things in the chat. So I think I'm going to just I'll go and answer them in a few minutes. So don't worry, I will get there. What not to say with someone with anxiety. Quit being dramatic. It's just going to shut them down. Or even depression. So either of these, anxiety or depression. You're just being lazy. You need to toughen up. Come on, it's easy. When are you going to grow up? You're crazy. Can't you try harder? Pull yourself together. Those are common things that teachers, parents, I've heard, and these are things we don't want to say. Instead, we want to know, this is where the empathy is. I know this is hard for you. That is such a perfect one because you're honoring them that this is not easy. I know this is hard for you. Take your time. It's okay, right? Slow down. It's okay. When I'm in session, if the kid doesn't want to say hi, take your time. We'll see if you can feel a little bit better and then bring someone in. How can I help? It's a great one. I'm trying to problem solve. I know this is hard for you. How can I help? So you get empathy and problem solving. What do you need right now? Asking them what they need right now. Want to talk about it? Sometimes they don't. I see you more than just your anxiety. This is what I love about you. And that's how you can spin that positive. Like I was saying, finding something positive, that will be helpful. So what do we want to do? We want to also, on top of facing our fears, changing our mindset, approaching anxiety differently, take care of ourselves and the kids. So anything can be on here. Like I said, it can be Dungeons and Dragons. I don't care. But making sure on a daily basis, we're doing something to relax. Deep breathing, mindfulness meditation, progressive muscle relaxation, any of these things. There are a million great apps. There's a million great YouTube videos about calming and breathing that are all good things that we want to start to integrate. Again, we have to make it, really crafted to each child or adolescent. It's not a whole thing. It could just be sports. It could be running. It could be clubs. It could just be playing music. They don't have to do sports, right? Another one that's great is find something to do for fun and not be good at it. That is a wonderful one. That's hard for the perfectionists. And have someone to talk to. So again, as you've seen, this is kind of the structure of cognitive behavioral therapy. The cognitive behavioral therapy works for both depression and anxiety. It's just so you'll have this, and this is kind of a good reference because I want to make sure to look at my chat in a minute. But it's an evidence-based treatment for both anxiety and depression. And what we want to do is, this is a cycle that happens where we might have a thought, we might just have a feeling, right? We might just feel anxious and then we think, oh, we're going to die, and then we run away. The thought might be, I'm going to fail a test, then we feel anxious and then we avoid that test. Or a behavior might just be, I'm feeling tense, then I must be stressed, and then I'm overwhelmed. So we want to intervene at any of these spots, okay? There's 3 different areas. Some kids will say, I don't have thoughts. Fine. Then you can work on the feelings or the behaviors, right? If they say, can't identify those feelings, okay, then we look at behaviors, because we all have behaviors that we can break down and do. So it is the most effective treatment for anxiety and depression as well. It focuses on your thoughts, behaviors, and how to manage unpleasant feelings. So let me look at the chat. This is a good thing just to look at. I just want to give a quick thing. When we looked, there was a dismantling study many years ago. What that means is it looks at the different components of cognitive behavioral therapy and sees which one works the best for depression. And when it comes down to it, monitoring daily activities and doing fun things, and fun can be reading, calling a friend, taking a bath, but actually actively scheduling them when someone is depressed can be very, very helpful. And many times the adolescent and child will have a hard time doing this. That's fair. This is where we need the counselor, the caregiver to start to do this. But it can be very helpful on when someone just gets out of bed, when someone just starts moving, they tend to increase mood. And that's what this slide is for. So let me look. Oh, good. It looks like there's been some responses. I'm just gonna take a quick look.
Yeah. So Dr. Berman, so there is a question about ideas for teens who refuse to ask for or accept help with school. Um, Parent believes it's a social anxiety issue, but it's now become a problem at home as well.
Right, right. And they're not asking for help, right? That's what it
Yeah,
is.
right.
Okay. And I assume so when they're not asking for help, but you're starting to see behaviors, it's then you have to intervene on the behavioral level. Does that make sense? So where can I do little things to help them? I'd have to kind of a little more detail of where it is. And but more importantly, I would honor that obviously something's going wrong, that they must feel anxious or depressed. And then really back to that one slide of how can I help? And then if they don't have ideas, what I always do is create a menu of ideas. And then I'm like, you circle where you want us to start, but we can't ignore this. Does that make sense? So it is true. Back to kind of the frontal lobes, they may not be able to come out with their ideas on their own. Okay.
Yeah, and then there was another question very similar about that their child is resistant to seeing a professional.
Ah, got it. Yeah, I mean, yes, that's really challenging. I think that's where you get there's well, three options, right? One is go back to primary care and see if even just their pediatrician can talk to them a little bit without you there, right? That's always a good, I mean, if you want to be there, that's fine, depending on the age, but I would think you go to the primary care, right? If there's a trusted counselor or teacher at school that you might have an in with, or a coach, that would be great. And then the third option that I do give my kids that come up and look at me and say, I don't want to do therapy, that's fine. I honor it, but you're having XYZ. These are behaviors that are interfering. I would like you to go. There is something called, there is medicine as well available. If you're anti-medicine, I totally get that. That's fine. But that many times I've run into probably about 20% where kids won't, even if I'm the nicest, smiliest person, they don't want to do therapy with me because their depression or anxiety is so bad that they do need that little bump sometimes of medicine to be able to start to express and talk to people. So,
Okay. If any other families have questions for Dr. Berman, please go ahead and put them in the chat.
yeah,
But I think Dr. Berman, you've addressed everything
perfect. Great.
um, so far. Yeah.
Okay, wonderful. And yeah, and actually, and again, this, it looks so simple, this behavioral activation, but it's got a lot of really a lot of research behind it. I mean, don't torture the child or adolescent with doing it. If you want to do it, you do it. There's also plenty of apps that can do this as well. But it's kind of that idea of, if you don't want to get out of bed in the morning, which many people don't, as by the time you get to adult, you get used to like throwing yourself out of the bed. But I've used even like slithering out of the bed, having the kid just move their body out and lay on the floor is just the first step to like kind of feeling better with those things. So what are the options? That's kind of what people were asking about. Is there's cognitive behavioral therapy. And for depression, as I was saying, the behavioral activation is the best part. I had one family where the parent was just pretty on point, although the individual, I guess with those teens that are resistant, this is not abnormal. And this was a resistant teen, however, was very into social justice. And so the mom was very clever. I didn't come up with this, and came up with the idea that, well, this is how you feel. This is what you're very passionate about. And the individual was definitely moderate to severely depressed and moderate anxiety, that we're going to volunteer in the afternoons and on the weekends. And that is where we're going to get out. Or another one, I had a girl, who then got a job, and that helped, working in a stable, just cleaning up, the horses' stables. Not that they have to be riding, just doing that and being near those things. So behavioral activation and getting kids out is probably the best. Interpersonal therapy is also a type of therapy for depression specifically that's been shown to be very helpful. Medication is also always an option. Again, I would recommend you talk to your primary care doctor about that. And then obviously, I'm a psychologist. I do not know all the details about medicine, or you could go to a psychiatrist within the community. And obviously, the combination of therapy and medicine is been shown to be the most effective, but there are also plenty of children that benefit just from therapy. So that's usually where we say to start. Why not start at the lowest? Because all medicines have side effects. And so, that's the best place to start overall. So this is us. We have studies for anxious kids. right? As you can imagine, they work with me in my group. We also have groups for depression and that studies depression in teens, which is great. So they treat depression in teens. This is again our study. I'm going to look at our chat and see these are the pediatric studies and the adult studies that we have. And then I think we'll have our contact information at the bottom. So let's see if there's any more. And
So
actually,
actually,
yes.
yeah, someone just actually direct messaged me a question, but I'll read it to you, Dr. Berman.
Okay.
How do you know if a teen is acting out for attention versus
Mm.
needing extra professional help?
That's oh goodness.
Yeah, that's a
That
tough one.
that's a really tough one. Yeah, I think that one's hard. I mean, you got to watch it obviously because it's not weird. As we started at the beginning of this session, teens are going to act out because of their frontal lobes, right? They're going to test boundaries. They're going to see how things are. I always go to, is it interfering in your life, right, or their life? The things that they either need to do or want to do. So if they have things that they have responsibilities around the house that they are not doing, right? And consistently, right? If this is every once in a
Right.
while, that's different. But it's consistent. If it's interfering in their lives or going to school, the things they have to do, and yeah, and then I would get someone involved.
So actually, this parent followed up and said that she said her husband's concerned about the therapy and diagnosis with being on a personal record, like for future jobs. How is that viewed in today's culture?
That's a great, I mean, that's a great question. And it's a normal concern. I have to say, I see that kind of all the time. Um, it depends on where the medical record is. In general, nowadays, specifically for therapy, that's pretty normal. Also, if you're under a certain age, usually that's not something that's going to be privy to someone when they're adult, right? I definitely have adults who are slightly more concerned about it. But I would say in general with kids, that's all confidential, and that's all something that is protected by the health acts. So I think there's definitely old stigmas in even current generations, but it's not something that be something that would be helpful to first talk to one of those professionals with those concerns as well before you send the child.
Okay, great, thank you. Um, another family member is asking how to model good coping skills for a 5-year-old. I guess he chews on his hands a lot. So
Oh,
what might be a good coping skill there, or how do you model
yeah.
that?
So that's a great, I mean, really good question. I think, there's a couple things you can do. One, when you have that kind of, we call it impulse control, like clearly, if he's chewing on his hands, he's not like doing it because he wants to. He must be feeling nervous or anxious or something like that. So, obviously keeping those hands busy is a fantastic thing that you can ask, like you can try and do. So, oh, maybe it's Lego time, right? At that time. Or maybe and you want one that like something, I guess, that has to involve both hands. That's why I like Legos or something building with two hands, or we have clay or Play-Doh, that kind of stuff. I know it's a mess in a home. I get that. But I think it's how can you engage both hands? And then I also think for you can model like, oh my gosh, when mom gets nervous, I do, you can, maybe there's something you got to do when you're nervous. I usually then go get a big glass of water and calm myself down. So you can also model how do you deal when feeling nervous or fidgety,
Mhm.
right? So it's those two approaches could help.
No, that's great. This mom has a teen who says he wants to go to exercise, but he won't go to the gym. Should we provide a positive incentive to get him to go? How, how
Ooh,
might they get him to go?
that's such a good question. That is like that's like the $1 million question. I mean, I'm laughing, but it is really true. It's very
Mhm.
hard to get kids motivated even when they want to, and that can be due to a myriad of reasons, whether they have social anxiety and he's worried about going. I would spend a little bit more time looking at what are the barriers to going. So is it that his schedule? Is it too early? Is it too far away? I would try to look at what is stopping you and can we problem solve around that? That's where I would start.
No, that makes sense. Does one panic attack mean it will happen again?
Oh, that's such a good. Oh, those are my My favorite. No, it does not mean it'll happen again. But it can make you more sensitive to having another one. It is most people. I think the numbers is about 60 to 70% of the population will have one uncued panic attack in their life, one or two. So it is very, very common. It doesn't mean you're primed to have it again. However, if you have that attack and then you get really afraid of all those symptoms you had, like, oh God, I hate being
Mm,
nauseous. Oh God, I hate being dizzy. That can prime your body to have more. So you kind of want to make peace with that. You might have another one, and that's okay. It's going to feel bad, but I'll live. So,
no, thank you.
mhm.
Um, I think we've got all the questions done. One mom did ask about um, insurance covering CBT. Um, what does that typically look like? Have you had experience with insurance companies? I'm sure you have, but
Yeah, I mean, it is very, I'm just going to be super honest. I don't think it's the
please.
easiest thing to find,
Hmm.
therapists that are covered by insurance. They do exist.
Okay.
I do tend to look at services, and then you might even be able to help me with some ideas, but like Jewish
Yeah.
Social Services, JESA is a
Right.
great option.
Yep. Hmm.
You can, and this is like the last option, pay out of pocket for the
Okay.
providers that are private and ask your insurance how much they will cover. Many times they
Right.
will cover something, but it is not
Right.
the majority of it most of the time. So
Okay.
those are kind of
Okay.
your three options.
Okay. Yeah. No. Understood. And it's hard. We get a lot of calls here about asking about providers in the area, and we just don't have enough
Yeah.
providers in the area.
And
It's really
specific,
hard.
yeah, and specifically
Yeah.
for children and adolescents. I'm with you.
Right.
I think we even have a hard time because if someone's allowed come to our study, we can treat them. We don't charge to treat them. However,
Right.
they have to look a certain profile, one, and two, then let us want to refer them to someone after, even if they don't fit for our study. And it is hard. I would just agree with you. We have a hard
Yeah.
time finding enough
Yeah.
providers as well. So
Mm-mm. So I know you don't typically deal in medication, Dr. Berman, but this parent is asking, is medication that may be given for anxiety, is that addictive? We're really worried about things like that with our teens and young children. Um, might you be able to address that?
yeah, yeah. I mean, on a very like global level, I can. So,
Hmm.
so very,
Yeah.
very important. I think your fears and anxiety of that is just spot on, and don't lose that. They do
Yeah.
have two classes of drugs. There is the benzodiazepines. Those are addictive. They are not recommended for children and adolescents at all, right? So we do want to that is exactly the right feeling, and I would not recommend that
Mm.
as a route at all to go for them. The SSRIs are not addictive in that way. Those are like Prozac or Zoloft, fluoxetine. And so those, I would talk to your primary care if you have questions about those. Those are a different class that have been really well studied in this age. And that's more the route that you would go. You're right, versus the benzodiazepines that a lot of adults tend to use. And those are not
Yeah.
even that great in adults, in my opinion.
Okay.
So,
Okay. No, thank you for that. I think that's
mhm,
helpful. Um, So this is a great question, and I think just because kids struggle with body image, how should we
mhm.
approach teens that are struggling with weight gain and anxiety?
Goodness, I mean, this is like a couple of my patients I have right now where it's
Yeah,
a really hard vicious cycle. There's
yeah,
weight gain, and there might be bullying or just
right.
self-consciousness, and then you feel already socially anxious. And it is very,
Mm,
very hard. I think, leaving it an open conversation for the parents to have, but obviously a lot of teens don't want to talk to a parent.
yeah,
So then making sure they have that trusted adult, and you just identifying like, I know it's hard at this time growing up. You don't have to say because of XYZ. If you are
yeah,
hearing them voice it, then please have those conversations with them. And then, again, I would find that peer that they really, enjoy, or more importantly, that trusted adult, whether it is their, music coach, whether it is that,
mhm.
religious member that can help support them.
No, thank you. All right. Not seeing any other questions. We want to thank you all today. I will get the slides from Dr. Berman. And several people had asked about it because I know they want to be able to go back and reference things. But really appreciate everyone being here. And we're excited for you to join us again for part two. But thanks, everyone. We hope that. you got some good information today and some strategies, please reach out to us here at the Family Resource Center. We have lots of resources here available to you as well. And we really appreciate everyone today and hope you all have a really great day and nice weekend. Thanks, everybody.
Thank you so much.